much, if not most of our Leadership Council content is actually learning from experts outside the region, but this is one where we learn from ourselves. So we have a packed agenda today, as you've probably seen in your invite, and it's just the way we have to do it. So my apologies in advance to all of you who are presenting, because we're going to try to keep you on a tight time frame because there's so much going on. But why don't we start then, as we always do, by just remembering that we would like you to help out the staff as we get feedback from our sessions to actually make them even more appropriate and better the next time around. So please take the survey at the end of the session. And we'll be running, by the way, if you didn't know, we'll be running till noon today just because of the number of presentations that are queued up to be given. So I hope you can all hang in there and hear these, because Whitman County's work is just as important as any other county, and we'd certainly like to give them an appreciative audience to what they've been up to the last year. So let's get started. As you can see here, we now start with a land acknowledgement, and we ask one of our attendees to recite that land acknowledgement. So we appreciate just where we are standing on, sitting on in our various computer seats. So who would like to take a stab at the land acknowledgement? Anybody raise their hand? I'm looking at a big gallery of faces. Anybody want to do this? Raise your voice. If not, raise your hand. Okay.
I can do it.
Brisa, do you want to do it?
Yeah, I can do it.
Okay, thank you.
We should take a moment to acknowledge that the land on which we live, work, and play contain the archaeological resources and tangible evidence of indigenous peoples. It is the historic homelands of the Yakima, Manapum, Nez Perce, Colville, and Umatilla people who remain committed stewards of this land, cherished it and protecting it as instructed by elders through generations. We are honored and grateful to be here today on their traditional lands. We give thanks to the legacy of the original people, their lives, and their descendants. You're muted, Patrick.
Let me unmute myself. We'll start with two announcements, and Demia Safford will lead us off with the first.
All righty. Good morning, everyone. My name is Demia Safford from Greater Columbia. I just want to talk a little bit about our upcoming event next Wednesday. It's a community event, The History of Exclusion in the Tri-Cities. Dr. Bowman and his colleague will be doing this small presentation on the history of the Tri-Cities with echoes of exclusions and resistance, voices from the Hanford region. They'll talk a little bit about the history, the tribal land, the experiences of some people that are listed in the book. It is a free event on Zoom. It's going to be 1 hour. We also have a book sale, a virtual book sale, and there will be a link to purchase this book if you like. And, oh, I can't see, I'm having too many notifications come up. Registration is free. And so if you have any questions, please feel free to reach out to me in regards to this event.
Thank you, Demia.
Mm-hmm.
All right, Carol, what would you like to inform us about another symposium?
Yes, this is a mandatory requirement of the Healthcare Authority by the Centers for Medicaid and Medicare, the one who granted the waiver to the state of Washington, that they hold an annual learning symposium. This year, like last year, We will be, the ACHs are going to be facilitating the discussions, although we're very excited to announce that our keynote speaker is Shoma Saha with the We in the World Network and Wellbeing in the Nation Network. And she is very dynamic. And then Yolo Aki Robinson with the Black Emotional and Mental Health Collective will also be one of the keynote speakers. So there's information here on how to join. We have about 600 people already registered for the event. Last year was a great success. It's scheduled over a couple of days, so it's not too overwhelming in terms of time. So please register. I think you'll really enjoy the content. We will be addressing the social determinants of health. So it'll be interesting for those of you tuning in today to see how our social determinants of health work stacks up to some of the other ACHs. The impacts of COVID-19, tribal partnerships, and new this year are youth-focused initiatives. Actually, I'll be in one of the breakouts, the future of ACHs and Washington's Medicaid renewal waiver. So I hope you can all join. Thank you, Patrick.
You bet. And the dates of that symposium, Carol, are, is it early November, right?
It's November 2nd through 4th. It's a virtual event.
Correct. Correct. It's on my calendar. All right, so now let's dive in to our Local Health Improvement Network's report out. And as you can see here, we've got 7 of them, stretching from Cle Elum down to Clarkston. So quite a spread of geography and quite a spread of different projects. And so we're going to have a variety of speakers just tell us what has transpired in the last year. And to do that, we're going to start here in the middle and then go outward with Benton Franklin Community Health Alliance. In particular, we're going to hear from Kirk Williamson and Abby Cameron. And I think, Kirk, are you leading or is Abby?
Kirk's up first, I believe.
Real quick before we jump in, I'm just going to show you guys, because we do have a full agenda, and to help everybody stay on time and just be cognizant of the amount of time everybody has to speak, I'm going to be flashing these little reminders on the screen for 5 minutes, 2 minutes, and then time is up. Oop.
Okay.
Shows. Just as a heads up, you guys will see those flash on there, just again as a helpful reminder to try and keep us on our schedule.
Stacey, were we supposed to see them just then? Because I didn't.
You know what? I think I need to share differently. You reshare.
Okay, Kirk, are you leading or is Abby?
I am, Patrick.
Okay, so we'll get those slides posted. Stacey, are you managing to find those?
Yes. Okay. They'll look like this. Can you guys see this?
Yep.
Yeah, we can see it. Thank you.
Okay, great. And here we go.
Okay, let's just go to my first slide. This has been kind of a busy year. As you can see, I've had an extensive travel schedule. I just wanted to share that with you. Next slide, please. A word quickly about the Benton Franklin Community Health Alliance. We started in the 90s with a group of business people who came together to help our hospitals have a safe political area to work together to create the Tri-Cities Cancer Center. Into the early 2000s, we incorporated as a 501c3 and began working on community health needs assessments and the community health improvement plan. Carol also in 2016 and 17 led development of the ACH. Next slide, please. So this is what we've been doing the last year or so. We've beefed up our website for one thing. We completed the health needs assessment and determined that those 3 areas that you see on the slide, behavioral health, access and cost of all health care, which includes behavioral health, and focusing on the social determinants of health. The logos you see on the right are those who support the Alliance with cash and in-kind services on top of regular participation by their staff. Next slide. There is an ancient curse that says, may you live in interesting times. Well, it turns out we thought 2020 was interesting, but apparently we didn't anticipate 2021. So we've done a number of things during the last year. One is a little video we did to honor healthcare workers in the early part of the year. In April, we thought perhaps we were turning the corner on COVID-19. We've also had a very active working Youth Suicide Prevention Coalition. The photograph in the middle there is one of our volunteers, Kimberly Starr, receiving a check from the Offutt Family Foundation and RDO Equipment. They're the big John Deere dealer throughout this area to support post-prevention for suicide, which is the sense that people who are close to someone who has died by suicide are often at risk themselves. And this committee provided what are called boxes of hope, which contain material to just help people process their grief. On the far right is a mental health crisis intervention wallet card. It actually folds up to be about the size of a credit card. It's actually several inches long when you unfold it. Has a lot of information about mental health crisis. We've printed probably 20,000 of those in the last year. They have been distributed in schools, and we keep getting demand for them. And we will continue to print those. And that's partly, at least in large part, uses money provided through our contract with the ACH. The bottom slide that's sort of tucked in there is something that we've supported since 2018, which is a confidential suicide, or not suicide, I apologize, a confidential tip line targeted for young people under age 21 or so in our state to report everything from potential suicide to potential attacks on schools to any number of other things, including violence, bullying, those sorts of things. There are 21 of them across the nation now in various states. Closest one is Oregon, and they are very successful in learning information that will help save lives. Next slide, please. Then came the Delta variant, and that got us pretty much focused on doing what we could to get people encouraged to get vaccinated. So you see the picture of Dr. Person and myself. That is really one of the weekly conversations that she and I have, about 3 minutes, 3.5 minutes each. And those are posted in various places and go in social media. We've also worked with our physician providers and partners to give us some information in their native language. Dr. Kawandi spoke to the, in Arabic, to the Islamic Center. Dr. Garcia, who is an emergency doc at Lourdes, spoke in Spanish, but he also comes from a Cuban background, which makes it even more powerful to that group. Dr. Shmarovsky from Prosser spoke in Russian, and those all went on social media. We also put together a vaccine clinic at Columbia Center a couple of weeks ago. First in line was young Desmond in that picture. Desmond showed up the morning of his 12th birthday, said, "I want my shot right now." Also, the picture with the little Badger Club logo on it is David Roach, who is a local physician who is now practicing at Mass General and is a Harvard fellow, research fellow. He talked about being on the front lines on a Badger Club forum that was very powerful, and then we cut it up and used it on social media as well. If you Google Badger Club, you'll be able to find the link to that piece if you want it. And then the health district really encouraged folks, community leaders, to step up to recommend that people get vaccinated. That's always a politically fraught issue, but we managed to get that posted in full page ads across the Alliance. Next slide. So that takes us back to the Community Health Improvement Plan, in which we identified the 3 key areas of the social determinants of health for our third-party administrator partner. We've had great partnership. I worked with them this summer, earlier this year, on the selection process to select the recipients of grants of funds provided through the ACH. And it's my pleasure now to introduce Abby Cameron, who is the executive director of Three Rivers Community Foundation. And she'll talk more about what happened to the money. Abby?
Thank you, Kirk. Yeah, we were thrilled to be a part of this process again. I'm kind of having to retool my brain because we're in our fall grant making, and I'm kind of rewinding back to May and June here when we did this work. But happy to share these projects with you. Next slide. As Kirk covered, his organization gave us our marching orders on the social determinants of health to address, and I think they really nailed it. Our focus was housing, food insecurity, and access to mental health services. And I think we found some projects that really are going to make an impact in those areas. Next slide, please. Our total funding to distribute out was $414,000. We received, I believe, 12 requests totaling $831,000. So it's a typical situation we find ourselves in with all of our grant making, much more need than we can actually fund. So the work of making those decisions by our board and with Kirk's help is critical. And we ended up awarding 9 grants to the organizations you see there. And I'm going to just kind of give you a little glimpse of what each of those projects entailed. I did reach out to all of these organizations for follow-ups. This money they received in July. A lot of these projects are just getting started. Quite a few of them involved hiring, which has been very challenging for various reasons at a lot of organizations right now. So it's taking a little time, but we would much rather they get it right and use the funds efficiently and get the right person in place. So just we're in communication with the organizations on what that's taking to happen. Next slide, please. So I'll just kind of quickly summarize each of our grants. Quirk's Place is a wonderful program run by Chaplaincy Healthcare here in Benton and Franklin counties. It's a grief support center specifically focused on children and teens and their families. What we were able to do with Quirk's Place is add a new part-time group coordinator who was also going to do some administrative work. The key there, I think for us really was the group coordinator, because it was going to address their waiting list. They do have a ongoing waiting list for their services, and you'll see this in a lot of the grants that we funded. It's adding positions so that waits can be reduced. So we were happy to do that. They have had some other staff turnover at Quirk's Place above this position, so they were wanting to get that hire completed before they hired this position, which I think makes a lot of sense. So it is still in process at Quirk's Place. They also do a lot of outreach in the community outside of their physical building and work with our schools when there are incidents and issues, and they're a wonderful support in our community. Next slide, please. We also funded Communities and Schools, Benton and Franklin. This was an almost identical project to what we funded them for 2 years ago in the social determinants of health funding. They put that grant together before COVID, but it really ended up being very timely. They were partnering with another organization in our community called Safe Harbor to distribute one-time housing assistance vouchers to families that they're identifying in the school system that are on the edge, risk of homelessness or critical issues in their housing. They expended all of the dollars that we gave them 2 years ago in this funding, and certainly will expend these dollars quickly as well, especially with the changes in the eviction moratorium. One thing that Lupe shared with me last time they had this funding is because there were all sorts of various government supports coming out, a lot of families were not really actively reaching out on housing needs. And so their site coordinators in all of the schools were really trying to be attuned to signs that families may need the support and being proactive and encouraging them to apply for the assistance if they needed it. Next slide, please. Another great organization that we have is Domestic Violence Services of Benton and Franklin counties. This project was specifically to add a housing-focused case manager to their staff. They do a lot of case management with their clients, but really focusing on someone to work with both their clients and landlords and apartment complexes and things like that on helping their clients get into stable housing. This is again, just kind of getting going, but what they've seen so far is having this dedicated case manager has reduced the number of days clients stay in their shelter by almost half. And all of the clients that they've worked with have been able to move into stable housing. So it's seeming to be a lot of effectiveness there, and we're very happy to support that. Next slide. Lutheran Community Services. This was a really slightly different spin on addressing the mental health issue. They wanted to do two things. One was offer mental health first aid to the public and to organizations in our community, which we're very happy to support. That's a great training. And they also wanted to offer some increased, really focused training for their staff. They recognize that as a nonprofit providing these services, staff retention can be an issue. They maybe aren't, the highest salary that someone can get for this type of work, but that if they could provide these trainings and kind of professional development opportunities, that it was a way to not only provide more services, but also retain valuable staff that they want to retain. This program's a little bit delayed with COVID. The training opportunities haven't been as easy to find as they had anticipated. And so trainings are being transitioned to virtual and things like that, and that's taking a little bit of time. So a little bit of pause there, but I thought it was a really unique way to address both access to services and staff retention, which is an important thing for any organization providing that work. Next slide, please. Pasco Union Firefighters, again, very unique. We got some really creative projects out there. A few years ago, the Pasco Fire Department identified a need to not only, obviously the firefighters are providing emergency services when someone calls, but to have someone to follow up with people who make emergency calls and kind of identify what other needs they have and what services they can be connected to. So instead of kind of just addressing that very immediate critical emergency need, they're providing more supports and connections for people who are calling the fire department and 911. That position is funded. They didn't need any support with that, but what they did find that they needed support with is their resource navigator, that they call it, is often working with clients in the evenings, on weekends, and needing access to dollars to get a family into a temporary hotel situation, or buy some food or some warm clothes, or just whatever help is needed, like in that immediate 24 hours, as they're also connecting that family or individual to other services. And the firefighters themselves had been kind of pitching in dollars so that the resource navigator had access to some funds. And they came to us to try and really round that out a little bit. And so we provided them some support so that the resource navigator has access to emergency funds to bridge that gap as they're connecting people to services. And this is all in an effort to reduce people's need for emergency services. If they're connected to more supports in the community, they're less likely to call the fire department and need emergency care. So happy to do that. Next slide, please. I haven't seen anything pop up. Am I okay on time?
Yep, you're good for another couple minutes.
Okay, thank you. I only have a couple more. Second Harvest, this was nothing new to what they've been doing for the past 18 months, 2 years. They've massively expanded their mobile market program, and we were able to help them just continue that really critical, important work. And so the dollars that we provided them will help get healthy food to over 36,000 people. So just really making sure that that program is supported and active and continuing to provide its service. Next slide, please. I have 3 more. Support Advocacy Resource Center, SARC, as we call it. This again was access to services. So we provided funding for an additional full-time counselor and a part-time assistant. Again, providing that trauma-informed therapy services to their clients who have experienced violence and crime. They do try and connect their clients with other mental health services in the community, but if it's a person who's falling through the net or can't get the quality of service that they need, that's what this counselor position is for. And also supporting a part-time assistant for the administration of that. One thing that we do when we're making grants around salaries, I'm sure all of our my grant making colleagues do, is we ask a lot of questions about, we're giving you 1 year of funding for a person for a salary. What's going to happen after that? We don't want to just band-aid. We also don't want to put a professional person in a situation where they don't have a steady position. And so we explored that with anyone that we were funding on a salary basis and made sure that they had a plan to fund the position going forward after that. So that was the case here as well. Next slide, please. Teen Challenge Tri-Cities. They have a program called Operation Red Eye. If you follow their social media, you'll kind of see what they're doing. They have identified the places where people who are kind of on the edges or homeless or low income are gathering, and pop up there in the evenings to provide food, clothes, hygiene. Some of the equipment they were able to get with this grant was to just kind of expand that a little bit and provide like a hot meal. They've got warmer boxes and things like that. So it's really meeting people where they're at. It's in the evening. The working homeless can access this and hopefully also connect people with other services and supports. So we were happy to support them. And then the last program is, I think, pretty unique. Therapeutic Writing of Tri-Cities. We call it TROT, T-R-O-T. It's a really dynamic program here that is using equine therapy to help people with, they bring all sorts of people there and provide these experiences. Trafficking victims, foster children, people with disabilities, PTSD. They work with Cork's Place and bring the children that are in the grief counseling program there for experiences. And they have really, it's a very structured opportunity to learn about horse care, have experience with the horses, and grow and change from it. I've seen it in action. It's really so much more than I can describe until you're there and your boots are dusty and you're seeing these experiences. This was, again, increasing access to services. They had an individual who was pretty much volunteering on a part-time basis to provide counseling services, and by adding some funding to it, they were able to really make it a position and expand the access to their services. So a lot of growth there in that program. Trot's doing some very cool things, and it can be different to wrap your brain around, but once you really see it, it's very powerful. So a really neat thing we have going on here in Tri-Cities. Next slide, please. And that's me. Our board was really happy to work on this project. We actually, just small anecdote, we had 2 or 4 brand new board members who came on board right before we did this grant making, and kind of threw them right into it with us in reading all the applications and doing the interviews. And it was really a great opportunity for new board members to see what we do and how the impact happens. And just thank you for using our abilities to help get these dollars out to make an impact.
And thank you, Abby. That was quite a menu of projects that you've undertaken there for, was it $430,000, something like that? Before we move on to Kittitas County, we have a bit of time, so thanks for doing that within the limits there, Kirk and Abby.
Thank goodness.
For questions, any questions of any one of those 9 projects, or the priorities that Kirk's group was able to identify? Carol.
I do have a question for Abby, and thank you for letting us know about the new board directors and how they got engaged immediately, Abby. Do you think the awareness that the LHIN has brought to this foundation has helped direct the dollars that you do have more targeted, or has it made, a difference in the way that you guys are funding other projects as well?
Absolutely. I think, Kirk participated with us throughout the interview process. They're reading the applications, sitting in on all our interviews, contributing to the discussion. And I think that was really powerful. We are all in this world, and we are all, connected and in the same Zoom meetings, but our board members are caring community volunteers, and we need to bridge that for them as much as we can, and not take for granted that they're not spending their days on Zoom calls about community issues the way maybe Kirk and I are spending a lot of our time. So that was really helpful. I think another piece of it, honestly, is that they hear from me a lot and my colleague, and it was nice to have a new voice. I think that helps as well. And I hope it'll spur further work and projects, both in the social determinants realm and elsewhere.
All right, thank you, Abby. Brisa, did you have a hand up? Just saying.
I was just sending clapping emojis.
That's what I thought. Okay, so Kirk, I think that there's a question directed to you from Lindsay from the Yakima Valley Community Foundation. Don't know if you caught that. Any other questions of Abby or Kirk? I just have a quick question from the facilitator's chair here, Abby, is that many of these programs seem to just be getting started. So you anticipate there's a bit of a runway over the next 6 to 8 months that they'll still be funded?
Yes, absolutely. I mean, the organizations just got the dollars in July. So July to October is not a ton of time for them to gear up for, especially when it's hiring related. So we will have another check-in scheduled, kind of our automated follow-ups for, I think it's April, to get another report out. And we're just in conversations with these folks regularly. So we always ask that question, do you see any challenges coming to expend the funds? And they don't. It's just kind of gearing up and getting things going. Great, yeah. All right. Well, thank you both, Abby and Kirk, for that report out from Benton, Franklin counties. Lots going on. And let's move to the west, to the northwest, and hear from Kittitas County. And we've got 2 people, well, actually 3 people reporting out. I don't know how you're going to handle this, Robin or Doug or Lindsay, but I think Robin or Doug, you're going first, correct?
Yep, I'll be starting us off.
All right. Floor is yours.
All right, good morning, everyone, and thanks for having us. My name is Doug Fulp, and I'm the Assistant Director at the Kittitas County Health Network. We'll go ahead and start into the next slide, which is a quick overview. We're a nonprofit that's local to bringing cross-sector organizations together to provide coordinated care for individuals. It started with looking specifically at how to help some of the higher utilizers of emergency services, and it really has spread out to be more environmental in our approaches. We are now up to 40 cross-sector organizations that participate within our organization. We have 7 groups that we have, work groups that work on a monthly basis, and 6 subcommittees that are branching out of those working on specific projects. Last year, we had just about $1.1 million, or for this fiscal year, starting in July, we have a $1.1 million budget. And overall, our organization is still pretty young, but since our beginning, we've had $3.24 million awarded. And this is one that I'm really excited about, is that we have approximately 100 active individuals within our organization, within those committees and subcommittees and special projects. And we're growing on a daily basis. And that's something that we're really proud of, and being able to bring in new sectors and new voices to make sure that we're being well informed. Also, we're up to 6.85 FTE in our organization, which is growing exponentially. I remember just about a year ago, I think we were down to about 3 of us, and 1 was on maternity leave. So we've done some great growing and been able to expand upon some of our projects in the past year. Next slide, please. Our board of directors is made up of 16 members from different organizations that are specifically targeted to address health in a number of different ways within our community. Our leadership council is then made up of 20 active participants. Our board of directors is a lot specifically elected individual or selected individuals, and then the leadership council is more of a voluntary basis. But our board of directors meets every other month, and our leadership council meets on a monthly basis, really to do that cross-sector sharing and to make sure that all of the work groups know what the other work groups are doing, and making sure that we're tying it all together at the network as the hub. Our priorities coming out of the strategic planning effort this last year are sustainability of the network, shared measurement, making sure that we're kind of all working again towards that same goal and same objectives, and then health equity and communication and community outreach. How are we being able to let the community know the work that we're doing and to help us, and that will also help us with our sustainability as more individuals know the work we're doing and know of our successes. Next slide, please. So now I'll go through some of our specific work groups and what the activities that they've been working on. Care coordination, again, is where it started our organization, and working specifically with individuals that are of higher need or need specific help within our communities. So right now they have 42 active clients. They exited 7 clients just in the past month. This was as of last month. So we're about a month behind in that reporting, but to exit the program means that they've fulfilled their care plans that were created through that cross collaboration of partners. And we're really excited about that, and the idea that not only are we growing that case load that our case managers are working on, but that we're exiting those clients, that we are improving the health of the individuals in our community. And from our beginning, we've always been looking, but now with the expansion of the network and as we've grown and gained new partners, we're able to start looking more of that upstream expansion, focusing on social determinants of health. Next slide, please. Next is our opioid use response group, as we're evolving it more into substance use and to be broad and more inclusive. This is one that is stemmed from a larger grant from the federal government, and to specifically look at opioids in our community. Since the beginning of that grant, which we're now just starting year 3 of the 3-year grant, we've increased drug take back locations from 1, which was only at the sheriff's office, to 8 now across the county. We've established a new medicated assisted treatment program at Kittitas Valley Healthcare. Our network partners have collaborated to provide medicated assisted treatment in the Kittitas County Jail. And this is one of those subcommittees that really does show the value of the network and the opportunity that we have. Our Kittitas County Jail received a grant to provide MAT in the jail, but no one of our partners could take on that entire project by themselves. So we brought together 5 different organizations who were able to split up the responsibilities of that. And it's a really collaborative effort, showing that we're really dedicated towards helping the individuals in our community, not worried about the competition in regards to that. And again, I just think that that's a great hallmark of the opportunities that we have within the network. We've also been doing a media campaign with our movie theater to do kind of the prevention and early intervention components, letting individuals in our community know of resources. And these are some of our events that we've done most recently, participating with the Department of Public Health and the Community Health of Central Washington to provide a overdose awareness day, which in our community was pretty, it was a touch coincidental in timing that we've had a number of youth deaths in our community due to unexpected fentanyl overdose. And so being able to bring community partners together, and one of our keynote speakers even spoke to, even if it was just bringing all of the partners together, that we had tables and different opportunities for people to engage. Just bringing the partners together is such a huge benefit to our community, but we also had a huge participation from our community and individuals wanting to know how they can get involved more. We have been looking to expand on our recovery services. We've helped with the development of the Kittitas County Recovery Community Organization, and we've actually begun doing recovery yoga, which we started over the summer, which is a program that we started because one of our nurse practitioners from a local practice had that specific interest. And so we were able to write that into our grant and provide the training for that individual, so that way they can provide classes completely free of charge for individuals in our community. And we're taking a little bit of a break right now, but that will be, we just finished our 15th class last night, and we're taking a little bit of a break, and we'll start in the new year with that one. Next slide, please. Our Resilience and ACEs Task Force, looking specifically at adverse childhood experiences, is a program that is a very strong collaboration with our public health department. Looking specifically, this last year we had to pivot with COVID, or as everyone has. And the original planning of that group was to work on a movie series to be able to have different community conversations that were stemming from different, I'm sorry, I'm losing the word right now, but different movies addressing different individual topics related to ACEs. We were able to pivot working with our Early Learning Coalition to provide social emotional learning books through not only our existing funds, but then through a collaboration with United Way. And I think up to date, they've distributed 2,000 books. And we're also looking to increase ACEs training countywide. That's something that is continually a part of any of our new grants that we apply for, is looking how can we really start to broadening out that the reach of our ACEs education. Next slide, please. Behavioral health work group is, I'm getting notifications on my computer. Our behavioral health work group has been a strong advocate for the 0.1% sales tax increase for mental health and SUD services in our community. This is a project that has had many iterations over since 2005, which was the opportunity first began. But in the last 2 years, the behavioral health work group has taken it on as strong champions. And then again, that's a really strong collaboration and cross-sector involvement, including law enforcement, first responders, youth, the school system, and many others that are just too numerous to name every single one of them. But these are some of our objectives that we are looking to accomplish through that. If we can move, hopefully in the future, to the enactment of that tax. We're looking to increase behavioral health interventionists in the schools. Again, focus on youth in our community is really important right now. To increase SUD treatment in the jail. And as we even just spoke yesterday, they've expanded having mental health services in the jail from what I believe was 14 hours a week to 40 hours a week. And they're still being able to fill that individual's time. And so being able to identify how can we long-term sustain that, understanding that right now our jail is sitting just over 50% capacity because of COVID protocols. And then to increase support for behavioral health in the emergency department, making sure that, and through some short-term funding, they've been able to hire crisis case managers, one who's been in the emergency department for about a month now, and one more that will be starting in November. But they were already be able to see the amount of time and connection to resources that individual has been able to have with those that are individuals that the emergency department is seeing on kind of a reoccurring basis. So we're seeing a lot of hope in those programs, as well as we're looking to identify how can we long-term sustain those. Next slide, please. Our childcare work group actually started as a subcommittee stemming from our substance use work group, but then really gained a lot of traction and became its own entity. We were able to do an extensive assessment project last year through some funding through the Washington State Department of Commerce. And we were able to look at and create kind of its own strategic plan for childcare in our community. As I'm sure everywhere, as we know from that assessment, that the state of Washington just is at a dire need for health, our childcare and our communities. And so we were able to identify a strategic plan. Some of the things we're looking at doing are supporting local organizations to apply for early learning facilities grants, increasing access to non-traditional times. Right now, there's 0 times outside of traditional business hours that are available in a formal sense, not counting the family care times, family and friends. And then also increase the number of available childcare spaces. And one of the ways we're looking to do that is to put together professionals to provide training for individuals who might want to start a childcare, but might find all of the paperwork and all of the steps and procedures to be a little daunting. And we're going to try to identify how to eliminate some of those barriers. Next slide, please. There's my contact information, but now I'll be happy to hand it on over to Lindsay Boswell to discuss that a little bit more from the Yakima Valley Community Foundation.
Thank you, Doug. Lindsay?
All right. Thank you, Doug. Good morning, everybody. My name is Lindsay Boswell with the Yakima Valley Community Foundation. I'm our Director of Grants and Community Impact, and have been really excited to work with our colleagues up in Kittitas. I want to give a quick shout out to a couple of my colleagues from the Community Foundation also on the call. You might get to see their smiling, waving faces. Ezequiel Beltran is our Director of Advocacy and Community Innovations, and Sharon Miracle, our President CEO, are on also this morning. And we're just excited to be part of this again. Go ahead for the next slide. So I have just a couple of things to share with you about our experience serving as the third-party administrator for the Kittitas Health Network for the past 2 rounds, and then want to leave some time to turn it over to some of our grantee partners from Opioid up in Kittitas County. We've invited them today to share directly some of the work that they're doing. But for us, this relationship with the Kittitas County Health Coalition started in 2019 when we were able to participate in the first round of this. And it was a really wonderful opportunity for us to get more connected with our peers and partners up in Kittitas County. Our primary service area is Yakima County, but we have always had some ties and funding available up in Kittitas. And so that was a really wonderful way for us to really dive in and get started, and has brought all kinds of partnership opportunities through and beyond the work with GCACH. So it's been really wonderful. Go ahead for the next slide, please. So for our work this year to support funding for social determinants of health, we had 5 applications from Kittitas County, which is more than we had last year. So we're always happy when that comes up, and we are able to connect with some new funders. And we were able to fund about 1/3 of the requests that came in. One of the things that we are always working on and are trying to be mindful of is what I call our yield rate, which is the relationship between how many folks are applying and how many are actually funded. Because sometimes the grant rounds are just brutal. And there's a lot of nonprofits putting in work to seek funding that we're not able to meet. And so one of our key strategies that we're always working on any grant round is how can we bring that up? So that we are funding and trying to support as much as we can. That's an ongoing work. But the focus areas that we worked on with the Kittitas County Coalition around housing justice and food and nutrition. And those were similar to the first round of those requests that we saw. Go ahead to the next slide, please. And you know, we built this process into our typical or ongoing strategic granting process, which we're really trying to use as a place to practice our commitment to equity, because I think it's a skill that needs practice, not a destination to arrive at, right? So, and the particular focus on health equity through this partnership with the health improvement networks is a really great way to also honor the Community Foundation's roots. We're a healthcare conversion foundation. So that really lines up nicely with the work that who we are trying to be in supporting our community as well. So here's just a quick snapshot about the grants that were funded this year. 2 of these were funded at partial amounts of what was requested, and 1 was fully funded. So the one for Habitat for Humanity, that was a new grantee for us at the Community Foundation, which is always a wonderful new partnership. And their project was really focused on home preservation and aging in place. So instead of constructing new housing, which is their primary set of work, this was really about preserving folks in their existing housing, which is a really important thing to do when the housing markets are so tight. So, and particularly with an elderly population who was extremely vulnerable, particularly in the pandemic, with health concerns and isolation. One of the other grants was to FISH, up there in Kittitas, and this helped to expand and continue their food as medicine program with more home delivery and more outreach, which as we all know, became much more of a need over the course of the pandemic. And so that helped continue some of their work. And that was a theme that we saw both in our grants from Kittitas, and you'll soon see us hop on stage to talk about our work with the Yakima County Coalition. But across both of those, we definitely saw work that was continuation of things that they had already started, which is a really great way to validate for you as a funder that you're helping to build that capacity and keep that work going. And I heard Abby reference that in her presentation earlier today. So that's always a really great objective that we're trying to achieve. And Apoyo is also a new grantee for YVCF, and we've got Stephanie and Sandra who will be able to hop on here in just a minute and share some information about their work. And this grant for Apoyo was really around building operational capacity, staff time, some resources to keep up with the demand and increase that they're seeing in the request for their services. So I've got one more slide that I'll share about us at the Community Foundation, and then I'll turn it over to the folks at Apoyo. So this one is just a highlight about some of the other work that we've been doing this year that would not have been as successful as it was had we not been able to partner with Kittitas more 2 years ago. So we have a Resilience and Response Fund that was set up to attempt to mitigate some of the impacts of the COVID-19 pandemic. And it has been operating since April of 2020. We are looking to wrap that up by the end of 2021. And it's been a continuously operating grant fund with a 15-person community advisory committee, which includes representation from Kittitas. If you had told me at the start of last year that I'd be running a grant round continuously for 20 months straight, I would have laughed and laughed. Because that is a different way to distribute a workload for sure. But one of our colleagues, one of our funding partners in this project, his name is Giovanni Severino. He said, this is our time to work in philanthropy. The community really needs our role to collect and distribute funds. So this is our time to work. We can rest later. And I'm really hoping later is coming. So, again, we wouldn't have had this slide had we not been able to do these kind of partnerships. So it's really been a wonderful experience for us to be able to do that. All right, that was a lot of words and not very many minutes. So thank you for listening. Go ahead to the next slide. So now what I'd like to do is invite Stephanie and Sandra to present. They're here from Apoyo. We had a little technical glitch, so we don't have their slides in this deck, but we can send them to the ACH staff so that you all can see them later. But so they're going to do a little storytelling for us about the work of Apoyo. Go ahead, you guys.
Hey, good morning, everyone. So I'm Stephanie Wickstrom. I'm the executive director, and this is Sandra Carrillo. She is our new program assistant. So we're really thankful for the Yakima Valley Community Foundation grant because it provided in large part what we need in the way of salary to pay Sandra. So we're lucky to have her here with us. She just started about 3 weeks ago. So the slide deck, which I hope you're going to have access to later, just tells the story of Apoyo, and I'll briefly summarize. It was in the mid-1990s when Central Washington was experiencing an influx of immigration from Mexico that CWU professor Philip Garrison, working with 2 other professors at Central and 2 of his Mexican immigrant friends in our community, started working with Northwest Harvest to drive down to Yakima, pick up food, and bring it back up and distribute it to Hispanic neighborhoods here in Ellensburg. In 1998, Central Washington University gave us permission to operate on their campus, given the connections between our founders and the university. And Apoyo became a joint endeavor of the university and some university organizations. In 1999, Apoyo was incorporated in Washington State, and in 2000 obtained its 501c3 status. So my slides provide information on our income, which is in large part from Northwest Harvest, which is where we get all of our food. We've worked primarily as a food pantry. We provide culturally relevant food, and we have distributions twice weekly, Wednesdays from 6 to 7 p.m. and Saturdays from 1 to 2. We don't turn anyone away. We don't limit how many distributions that families may have each month. We also provide material support. Community members donate and receive clothing, furniture, and household items. And in our partnership with Central, we also provide education, class projects, internship, graduate studies, opportunities for CWU students. And we're starting to offer more in the way of Spanish English classes for community members and immigration policy workshops. So we're excited about what we're moving forward with now. We're moving off of Central's campus, and we're going to be building our own facility, a passive solar straw bale building built with contributions of minority-owned businesses and lots of volunteers in our partnership with the Odd Fellows, the international or the independent order of Odd Fellows here in Ellensburg, is giving us a portion of their property for 99 years for $1. It's a lease. So we'll be beginning that construction next year. And meanwhile, we're really trying to focus more on our larger mission. So from the beginning, although we've been a food pantry, we are also dedicated to providing outreach and advocacy to Latino communities. We liaison between Latino communities and private and governmental organizations. And we're here to foster a greater understanding of the presence, history, culture, and contributions of the Latino communities we serve. So I really want to focus on the essence of our mission is empowerment. And as we engage with other community organizations and directly provide services, we're also looking to advocate for inclusion of Apoyo's clients or members, we're going to say, in larger community efforts. In one example we can give is public health. So we're happy to be participating now with the Kittitas County Health Network on their leadership council. And I think I just want to say that we need to have more room in our professional culture for people who are coming from different cultures and don't speak English as their primary language. We're getting invitations from community organizations to participate more. I am not a member of the community that we serve, but there are lots of people here at Apoyo who do want to serve. And so we would really like to see other organizations making that more possible for Apoyo's members. Thank you.
Thank you, Stephanie. Thank you, Lindsay. Thank you, Doug. And I see Robin's on the line. Thank you also for being here, Robin, from Kittitas. And if there's time for a real quick question of what's going on in Kittitas, we'll take it. Anybody have a question of the presenters? All right. Well, you, unless I'm missing a raised hand, you certainly have ways of connecting with each other, and that's really one of the goals here today, is that you get inspired by what you hear and actually you reach out and start a dialogue with somebody from a different county, a different group. So let's move south to Yakima County, and we're going to hear from our own GCACH Rhonda Houff and Dan Ferguson. And then we'll circle back, or Lindsay will circle back with us and talk about their activities, or the foundation's activities in the county that they reside in. So Rhonda or Dan, I don't know who's leading, but the floor is yours.
Thank you, Patrick. Appreciate it. Rhonda is not here today. She's on a very well-deserved vacation. And so I was asked to go ahead and present this information. Next slide, please. So we have a very active coalition. Hold on. We have a very active coalition, and we're engaged in a number of strategies and activities. We meet twice a month, and I'll just be providing an update with you regarding what's happening with our involvement with addressing the pandemic, talk about our resources in 201, patient activation, affordable housing, and how important our networking is with each other. Go ahead, next slide. So we had involvement with the University of Washington and community assessment. Our coalition has been very active with addressing the needs of the and responding to the pandemic, particularly around addressing public health strategies, masking campaign, vaccination efforts. One of the recommendations that came from our participation with the community assessment, and it's actually on the next slide, was that we really need to work at improving communications. And these are recommendations that came from that evaluation. Was we need to increase our work with digital channels, increase Spanish language information, and have definitive guidance for specific stakeholder groups. Thank you. Next slide. Some of the recommendations regarding testing accessibility was to address the financial barriers to the provider-based testing, to provide or implement further investments in community-based testing sites, and to diversify testing strategy to meet community where they are at. Specifically around relaunching at-home testing. I know there's been a lot of conversation about that, and to coordinate with small farms and agricultural sites. The next slide, please. Thank you. We've worked very closely with our colleagues at the Yakima Valley Community Foundation regarding communication strategies. I think this slide kind of just represents the importance of tying in cultural issues, language issues, issues around faith in messaging to our communities. Next slide, please. So the coalition was involved in a pilot project in the fall of 2020. Washington Department of Health reached out to inquire if we were interested in a pilot to distribute pulse oximeters to COVID-19 patients. We agreed that this could be helpful to our patients and medical team. Next slide. So this is kind of the key takeaways. The key lesson we learned is that it isn't really just the device that is important, but the wraparound services for education and follow-up. The videos and call scripts were important to assure some degree of consistency when it comes to education and triage. All in all, the patients were very appreciative of the process. Next slide. So my understanding, and if someone would like to help me out here, who's actually a medical practitioner, with a pulse oximeter is a way for a medical provider to have real-time information coming from their patients that are actually based in the home. And then this allows for readings to be obtained by the medical provider, and is a great way of determining whether or not there's any risk to the patient, or readings that might indicate a need for. Look at that, we have a definition of a pulse in the chat. So a tool that can tell oxygen saturations and heart rates. See, there you go. That's called call a friend. So gratitude was a common theme. Several patients spoke of the reassurance and stress relief that this and the education brought to them. One detected a rapid heart rate and was rushed to a hospital. The patient was having a heart attack. The household had been diagnosed with COVID-19 right before Christmas Eve. They were dealing with multiple family members who had COVID-19, and a relative actually had died. Our COVID-19 team helped them with groceries and funds for housing. A month later, which is when the survey was administered, the patient's husband had barely returned to work and was still recovering.
Yes.
Yeah. Oh. Next slide, please. So Coalition is very active with our local partners who provide 201. As you can see, we have identified the top request categories. We have Madeline Carlson, who is on our coalition, present and address the coalition at least twice a year. Next slide. One of the key activities or strategies that the coalition is involved with is, I think there's 4 to 5 organizations that utilize the patient activation measure to evaluate engagement of their patients and clients. And I'm pretty sure most of you are familiar with the patient activation measure, but it's essentially a way to evaluate a client's or patient's level of engagement with their health and with their health care. And as you can see by these categories, it ranges from level 1, being disengaged and overwhelmed with their health care, up to a level 4, where they maintain behaviors and really address and take control over their own health and well-being. Next slide. These are some of the numbers regarding the different levels for the distribution of the evaluation. Next slide, please. This is really kind of the most important slide. And I know what you see here is primarily numbers. And I think what's the key piece or the key takeaway is that if you direct efforts towards, for example, those less inclined to be active in or being responsible for their health care, if you direct efforts, then your return on investment, your return for the money invested in this, and the return on kind of directing staff towards level 1, level 2, and level 3 patient populations, you get more return on your investment. As seen by, if you can see that expected savings per individual in the middle of the graph there, it's $2,317 for a movement from level 1 to level 2. And you can see level 2, if a if a patient begins to assert more individual responsibility towards their healthcare, that savings, that cost savings is eventually realized. What's interesting is as patients increase their kind of activation or involvement or engagement with their own healthcare, the savings isn't as great, but it's really focused. This is really focused and demonstrates the importance of working with individuals who aren't necessarily so active with managing their own care. Pretty exciting work, actually, that the coalition has been doing with this. And certainly investment in this is worthwhile. And my time is up. Keep going, please. Our coalition is very interested in housing. That speaks for itself. Next slide, please. And last but not least, we always finish our coalition meetings with what we call brief and sassy updates, an important method of getting kind of awareness about what's going on in our community from each one of our partners. And I will hand this over to Lindsay then.
Awesome. Thank you, Dan. I aspire to be brief and sassy pretty much every part of my day. All right, everybody. Me again. Go ahead to the next slide. Similar to our work in Kittitas, we've been able to serve in this role for our Yakima County Healthcare Coalition. This is now the second cycle we've been able to do that. In 2019, we were able to combine several different funding sources, so that essentially doubled the amount of funding that was provided by GCACH when coupled with what we had available, which is wonderful. That's a great, when it is really exciting when those kinds of compiling of resources happen. And in particular, what I think was really lovely about it was that our board had been working on addressing some components of health equity. And when we met up with the folks from the Yakima County Healthcare Coalition, there was a lot of alignment in what we were both interested in working on. And I think you can either attribute that to luck or a full moon or whatever you want to call that. But if I think a little deeper about it, I think it's actually a really nice reflection of the work that we as a community foundation try to do in listening to our grantees and our partners about what they were seeing that was concerning them, and being responsive to that and understanding what's going on in the community. So I think there's a little bit of luck and a little bit of listening that has to happen for those things to end up together. And we're excited that that theme really carried forward in our work this round. Next slide, please. So I would like to explain this completely embarrassing picture of myself. So one of the highlights that we had this year, which was what we called our Feel Good Fridays. And this was a process that was devised and orchestrated by my colleague Estacio, who has this very lovely like TV anchor picture here. And all I have is this weird picture of me making a strange face. But what we did was our reporting process is interview based. And so what we do with all of our strategic grantees is we set up an interview, and then we as staff take the burden on of writing that report for our board. So we get the chance to just have a conversation with our grantees. They're always really amazing. We learn a whole lot more than we do by our written reporting process. But you know, my life tip that I will share with everybody today is what we've learned in the landscape of Zoom meetings is, like, if you're gonna need a picture of all of you in the Zoom meeting, make sure everybody takes a minute to pause, smile at your camera, and take a screenshot, rather than going back and doing a screen grab from an interview, because I will now probably never watch one of my own interviews again, because all you do is make weird faces when you talk. So at any rate, but this was a really wonderful process, and we're really excited about continuing that as we go forward. Go ahead to the next slide. So this is a snapshot of what the granting looked like for us this round. And we've also lined up one of our grantees, our partners from Team Child will be hop on here in just a minute to share some of their work. But again, we're always keeping an eye on the yield rate. So this is fairly competitive process, as they always are. And again, we're always trying to figure out the right balance of focus area, recruitment, funding source, so that we are as respectful of our grantees' time as we can be, while also making sure that we're able to select the most competitive and the project. So that's a delicate balance, but that's one that we're always looking at. And then I would also share that we were able to braid some of our own funding in with GCACH funds too, to extend that impact, which was great. And again, reinforces that alignment that happens when we continue to build these relationships over time. So we were really excited and thankful for that piece. Let's see, go ahead to the next slide, please. So the focus areas for this year's grants with the Yakima County Healthcare Coalition were similar to years before, but had some specific new elements included. So we had focus areas, and then we had that were housing justice, behavioral mental health, and education based. But then for all of those areas, there were, we made a specific call out around strategies for transportation, resolution of legal issues, and employment, education, or assistance. And we were trying to capture that intersectionality of focus areas and supports. And so, again, one of the grantees, Team Child, is going to share a little bit about the work that they do that fits into this. Next slide, please. This is not the most reader-friendly slide because there's a lot of numbers in a pretty small amount of space, but it's there for if you want to look at it later on in the slide deck. But this is a summation of all the different grants that we were able to award in this round. And again, it's a combination of community foundation funds that we coupled up with the GCACH funds. And it's a beautiful mix of grantees that we've seen before, and the work is continuing to progress, and some new grantees that we hadn't worked with in this capacity. So that's one of our success metrics whenever we're doing granting. So we were excited about that. Next slide, please. Again, this is just another snapshot around our resilience and response funds. So in Yakima County, our funding partnership distributed almost just shy of $2 million so far. And across many of these different emergent areas. And lots of our funding partners from these past two rounds with GCACH were ones that were we were able to fund in this round. And because we had done work with them before, the timeline for getting some of these funds out was much shorter. Some of them we turned them around in as short as a week, which is a hustle. It's not a pace I would recommend sustaining forever, but that was what we needed at the time. And so again, it builds on work that we had already done, which is a really wonderful manifestation of how these partnerships, I think, are intended to work. Go ahead to the next slide, please. Okay, so now I'm going to be officially done talking, which I'm pretty excited about. And I'm going to turn it over to our partners at Team Child. So I believe both Sarah and Theresa are on the line. So I'll turn it over to you all to share about the work Team Child does. Thanks, you two.
Thanks, Lindsay. My name is Sarah Zier. I'm the Director of Legal Services at a nonprofit called Team Child. And we, I do have, are my slides here too? Okay, I prepared way too many slides to, this is a problem lawyers have as we talk too much, but I provide too many slides for us to go through today, but they might, if you all get copies of those, I hope, provide a little more information about sort of the why we do what we do. We were really excited to partner with the foundation because a lot of our priorities align. So specifically, Team Child was created as a collaboration between civil legal aid providers and public defenders many years ago to try to stop what public defenders saw as the cycle of kids coming back through juvenile court over and over again. So they would be detained or their case would be resolved, but they would keep coming back. And you can go forward in the slide. You can see our mission is really to keep kids out of courts, but to do that, to ensure that they're safe and have access to education, healthcare, and housing that they need to achieve safe and productive outcomes and their goals in the community.
So again, it's kind of complex because it's a novel concept. Like, why do youth need lawyers to do these things? And the reality is just a lot of the equity issues that you all have already been talking about today. So there are significant disparities as far as which youth get caught up in court systems, who has equitable access to school without school discipline, breaking up that continuity, and who has access to services, including healthcare, also special education, and other components that they need to achieve success in their lives. So you can go ahead and skip. This is sort of, and again, I won't go through all these slides because I did way too much for the time we have, but our model for doing that is to provide direct legal services to young people. So we work with youth, and I'm gonna trade off to Theresa to talk a little bit specifically about the direct legal services in Yakima. We serve 4 counties in Washington state, and this grant is specific to our Yakima County office. But we provide civil legal aid on pretty much anything that's not public defense and that involves a youth. So our clients are the youth themselves, and they direct our work, which is really an empowering and exciting process to be part of, and why I've stayed at Team Child for over 10 years now, because getting to work with young people to identify and achieve their goals and work towards them is just phenomenal. So we provide direct legal services. We also partner with community to provide training and know your rights information, and do some systemic policy work to try to change the system, so that recognizing we won't solve kind of problems one case at a time. We need to do the broader system work too. So I'm going to pause and switch over to Theresa to talk about the Yakima stuff, since that's the focus of this grant. Except for the last thing I'll say is where we do serve youth statewide and sort of all over this group's coverage area is youth who have been incarcerated in juvenile rehabilitation facilities, which are our state's juvenile prisons. And we do have statewide work representing youth in all of the counties of the state on both addressing some of the reasons they're incarcerated, but also their reentry work so that they can have access to housing and education when they get released from our juvenile prisons. Theresa, I left you with less than 2 minutes.
All right, perfect. So yeah, I'm Theresa Harman. I'm a staff attorney in the Yakima office. And I think historically, the Yakima office has been known for school discipline cases and special education. And now that school's back in person for a lot of people, we have seen increasing referrals from youth that missed out on educational services during the pandemic. And that's been, I think, really important, trying to figure out who's kind of been left behind. And I think what we've been seeing is it's mostly youth of color that maybe weren't re-engaged. We kind of have to figure out, was it like access to technology or housing or mental health? But part of what I've been working on recently is trying to re-engage youth in school, figure out how many credits they have, where they're at, and how to catch them up. And then also working with youth receiving special education services to advocate for recovery services for instruction they missed due to COVID. I also recently have been working on with housing. We've been able to utilize different tools for placement, such as minor guardianship and CHINS petitions. And then also removing barriers to housing might just look like stealing records or connecting services. So I think we're focused on outcomes that help young people sustain themselves and thrive and meet their goals. And this can mean really a variety of things, including adequate support services and healthcare services. So I swear sometimes I just work with youth and young adults to connect them to the right people and try to remove a barrier that might be more of a soft advocacy. But yeah, it's been a variety of things really, and I've been really excited to be in the Yakima office. I'm a little on the newer side, so I'm on a learning curve, and I've loved that we're youth led because they kind of get to tell me what it is that they need, and I can try to make that happen in a really holistic way. I don't think that we're limited as a lot of lawyers can be, because we do so many types of advocacy and get to partner with public defense. So I appreciate you letting me share about what we're doing in Yakima.
All right.
Awesome. Thanks, you guys.
Thank you, Teresa. Thank you, Sarah. Thank you, Lindsay. Thank you, Dan. Thank you, Rhonda in absentia. We're going to take a break now, 10 minutes, but I hope that you've been stimulated by what you've heard. I certainly have. In fact, my head's kind of spinning. I said, you know, we talk a lot about the social determinants of health, and when you start diving into that, it goes many different directions. And these are all very, very exciting, and I think worthwhile exploring more if we just had the time. So I hope you can think about that and follow up with the presenters at your leisure. So we'll take a 10-minute break right now. We'll come back, and then we'll be talking to counties east of the Columbia River and seeing what they've been up to with the grants that they've received from Greater Columbia. So stay tuned and be sure and circle back 10 minutes. Welcome back, everyone. It's 10:35, so staying on schedule because we've got quite a lineup here after the break. We're going to start. And we're first going to hear from Martha Landman and Jack Davies. For those of you who have been with us over the years, you may recognize those two. And they represent the Southeast Washington Alliance for Health Partnership. And then we're going to hear from the Blue Mountain Community Foundation in the remaining time of this particular slot of Southeast Washington. So Martha or Jack, and Jack, the floor is yours.
Thanks so much. Can you hear me okay?
We can.
Cool. And Martha is actually also on vacation this week, so it's just me. And then here shortly, I'm going to be turning it over to Greer. But just this group, can I have the next slide, please? This group originally was called the Southeast Washington Health Partnership, and then had the opportunity last year to formalize as a 501c3. And one of the things we learned was partnership is considered a business type name when one goes ahead and organizes it as a formal state entity. So we became the Southeast Washington Alliance for Health. I've been working with this group in 2017 when it came together to really look at how we do community health improvement plans and partners and projects across 3 counties in the southeast corner of the state. Of course, these are all small and in many cases very, very rural counties. The members of this group include all the healthcare systems in those 3 counties, public health agencies, behavioral health, aging and long-term care. And then we also have a lot of other kind of organizations, social service organizations, local government, transportation. As I said, it really started as an informal collaboration and emphasized, but formalized last year. It has been an entirely volunteer organization with participation by folks who work in all these other sectors and have been giving a piece of their time to make things happen. Next slide, please. One of the first things we did together was a multi-county community health needs assessment, which was sort of our first time that this group had done that. And it helped us identify what was common across the region and what were some of the particular issues. And with that community health needs assessment, we then spent some time focusing on health priorities and trying to decide what we wanted to really try to have an impact on across the region. And everybody really feels that youth and are the ones that are having the most difficulty. And this was all done actually pre-pandemic. It's only gotten worse because of the pandemic. So the priorities we identified were overweight youth, challenges with immunization amongst youth, substance abuse, but again, with a particular focus on youth drinking, bullying, and then more broadly, access to healthcare. There's some variability between counties, but these were definitely common themes that resonate across the region. And again, as I said, we actually did this prioritization work pre-pandemic. This was in late 2019 that we were finalizing these, but this has all just gotten worse. So next slide, please. So we had that collaborative, we had that prioritization work done. And then began partnering with the Blue Mountain Community Foundation as the third-party administrator for the Greater Columbia funds, and recognized that those regional needs should be the focus for those community improvement funds. Worked with Blue Mountain Community Foundation on the process for selecting for both calling for grants and selecting recipients. And Greer Buchanan is going to talk about that in a lot more detail here in a few minutes. But in general, some of the things we highlighted and focused on were improving access to fresh foods and vegetables in the region, facilitating access to health insurance through navigators, meeting transportation needs. Transportation is a huge issue in the region, and came up with some innovative ways to help improve that. And then just access to mental health programs, both formally and informally, ways to particularly target the youth that needed help in the region. So the next slide. So Greer is going to talk about all of those things in a lot more detail. So I want to just sort of give you a little bit broader sense of what else our alliance has been doing. And we've had a big focus, given that it's a fairly new collaborative, and as I said, it was an all volunteer group, it's been really successful at bringing new funds to the region. The first was a grant from the Health Resources and Services Administration, which was a network development planning grant. And we use that in part to help support the creation of the 501c3. And then last year, we're very successful in reaching out and connecting with the Group Health Foundation, and have received $350,000 that'll be over a 3-year period, particularly to support response to COVID, but also to meet other community needs. Some of the things that have been done with some of those funds are direct funding to each of the 3 counties to support some local mental health initiatives for youth, some support to schools, particularly in Dayton and Pomeroy, for healthy youth programs. And again, support for local food banks. You keep seeing these recurrent themes because we've identified these as really the high priority. And then very recently, the group has been successful at receiving grants from the State Department of Health. It's actually a combination grant from the CDC and the State Department of Health. It's going to be a little over $750,000 over 3 years, starting now, to address population health issues and disparities, particularly as a result of the COVID pandemic, but also recognizing that there's a lot of sort of comorbidities, so to speak, around the COVID pandemic and population issues that can be helped with COVID funds. Half of that money is going to be focused specifically on Asotin County, and half focused on Garfield and Columbia. And sort of the last piece of this, as I've said, this group has been largely volunteer driven, but because of this funding and because of the increasing joint activities that we're doing, they've made a decision to go ahead and bring in a part-time director, somebody who will be able to dedicate time to directing these projects, beginning to organize more officially in the different counties, and leveraging the resources that already exist. Next slide. So that really is part of looking ahead. We recognize that a number of things likely have changed. We know that there's a lot of impact from COVID. We know there's a lot of impact, particularly in the area of health disparities. And we're looking to get back and do a new assessment to get a better understanding of what those disparities have been, what new needs have emerged. As I said, we know that mental health, youth mental health in particular, is a huge issue. We also are going to be looking at developing approaches to address those needs, including the increased use of community health workers, partly through our collaboration with Greater Columbia. There's been already an increase in the use of community health workers, but it's still pretty limited. And so we're hoping that with these new funds and with some dedicated staff time, we can help bring more of those into the region. And then of course, we're going to continue to support coordination and collaboration across the 3 counties. So that's just a real high level look at what the Southeast Washington Alliance for Health has been doing. Next slide, I think that's my last, yeah. So I'm going to turn it over to Greer at Blue Mountain. I do want to say, and this resonated a bit with some of the work that was being done in other parts of the Greater Columbia region, that I think that these TPA funds and this relationship has really helped increase awareness of Blue Mountain in the southeast corner of the state, and I think has opened up the door to other collaborations. So we're very grateful and appreciative of what Blue Mountain has done and what Greater Columbia has done to help make this relationship possible. So Greer.
Thanks, Jack. I will echo what she just shared, that this has been a very fruitful partnership and has really expanded our knowledge of the services needed in our region and the opportunity to partner to help achieve just better service for everybody. So thank you all. Can I have a time check, please, Stacy?
You have, I'm sorry. You have 15 minutes. You're good.
Oh, okay. Well, here we go, guys. I've been sitting here wondering if it's better or worse to go after Abby and Lindsay. I'm not sure if I've decided which one it is. But anyway, here we go. So we served as, Blue Mountain Community Foundation served as the third-party administrator. You can go to the next slide. For this last round of GCACH funding. Look, I'm getting better at not calling it GCACH to all of you who hate it when I call it GCACH. So for the Southeast Washington Alliance for Health, the Columbia, Garfield, and Assotin counties, we were awarded, or we were provided $108,924.15 to distribute to nonprofits in that region, serving, let's see, I added my social determinants of health. So we were looking specifically at the SDOH, including overweight youth, youth immunization, substance abuse, with a focus on youth drinking, bullying, and access to healthcare. You'll see that we touched on 4 of the 5 of those. We did not receive any proposals to address youth immunization, which I just thought was noteworthy. So we did assemble a grant review committee team that included members of both of our LHINs and then a retired doctor, and then a BMCF stakeholder, and then I just sort of administered the program. Next slide. So these are the proposals that were awarded a grant. I made notes. Lindsay, thank you. You are a great resource. We funded 70%. So we actually received 20 applications and we funded these 14. Our total application dollar amount or request amount was $263,000, and we of course had that 108 and change. So you know, it's a 70% approval with about a less than 50% award. So to echo what Lindsay said, you know, it's hard. This committee worked hard. Next slide. So we just have a few updates, some really cool projects. So the city of Pomeroy was awarded $10,000 to address overweight youth through a redesign of their community park. $10,000 is clearly not enough, but it gives them a start. And I think they're on the right track. They've got some really cool ideas here. They've got a couple of proposals, and now they get to navigate, you know, going into construction in the middle of a pandemic, which I don't envy them, but they're working on it. Next slide. This is, I didn't see that Rachel was on this call. But this is a really amazing project that she is spearheading. So Garfield County received a grant to hire or train an existing nurse in foot care for aging populations. And there was a concern, to echo what Abby said about this, you know, when you pay to hire someone, what's the sustainability proposal? But and then also the recruitment and retention in Pomeroy is a challenge as well, which we've seen in our past GCACH grant rounds. But they've identified a nurse who is actively receiving training for foot care and should be providing services by November. So that's there you can see the quote. "I'm so excited about this," says Rachel. Next slide. Access to healthcare. So we are supporting the work of it's Rachel, again, Rachel Anderson with Garfield County, as she helps low-income individuals navigate and secure insurance funding. So far with the funding, she's been able to do that for 15 people. Next slide. This is a neat one. Interlink is transportation. You can see here their stats. They don't charge, it's all volunteer run. 397 rides since they received their grant. And this is in Asotin County, which, as we know, has a great need for assistance. So this is one I'm really happy to report on. Next slide. So the focus on teen alcohol use through the Clarkston Epic Community Coalition. They have a very comprehensive plan. They've done a lot of work, and it seems like they're actually meeting youth where the youth are instead of creating a plan for adults, which is something that we see sometimes. So they have a social media plan. They have all sorts of activities that sound really powerful and engaging for young people. And then they're partnering with other entities that are experienced with sharing messages to youth and really working hard to get that message out there. Next slide. So a similar thing happening in Pomeroy. The Pomeroy Partners for Healthy Families Community Coalition. Sorry. So again, they are working on just focusing on youth drinking, educating the youth in their community. But they were able to, with this grant, actually identify 14 volunteers and provide coverage for them to travel to a training. And so this is I think this is the first time in, their 8-year history that they've actually been able to send volunteers to a retreat to really focus on this topic. So that's exciting. Next slide. Of course, the club, the work they do every day helps with social and emotional support. They've really drilled down into focusing on preventing bullying, or at least helping their kids identify and deal with the aftermath of being bullied. So they partnered with, I don't know her last name, so if anybody can say Rosie's last name.
It's Neacham.
Say it again.
Neacham?
Neacham. That's not what I would have said. Thank you, Amy. So she is the school counselor in Waitsburg, and every Monday and Wednesday, she visits for an hour and works with the youth at the club to focus on bullying, social and emotional learning, cooperation, and she is contracted to continue those days through the school year, which is huge. Through the pandemic, we've heard a lot from Jim at the club about just the increase that he's seen in social and emotional issues with his students. So having access to some support on that front is really great. And we've actually been working on that since early 2020, mid 2020. Next slide. Oh, hey, look, I'm done. So we served as the TPA for 2 LHINs. And this is the beginning of my reporting for the next one, after Amy speaks to the work of I'm still going to call this boomer chip because I don't remember.
Greer, can you just pause for a moment before we move a little further west and see if there's any questions on what's going on in Southeast?
Absolutely.
From people on the call still?
And I do want to just weigh in here. And I think that this is sort of an important philosophical piece to note is that one sort of strategy that this group adopted was more smaller grants rather than a few larger grants. And I think part of that is the characteristic of these small organizations that we're working with in these typically rural communities. A little bit of money goes a long way. And they're very good at leveraging small amounts of money and tying it to existing resources. And again, a lot of the resources are volunteer, but using that to help make other things happen. So I just want to point that out. And again, having Blue Mountain administer that has also made it super helpful.
Thank you, Jack. Yeah, and we offered, so after we went through the award process, and we did fund a couple requests at the full amount that they asked for. But obviously we can't do that for everybody. But we did turn around and offer the opportunity to support to some of our donors. And one person took us up on it and covered the difference for the Holy Rosary Foundation. They do a backpack food program for children for over the weekends. And they asked for $11,026. We funded them at $6,000, and we had a private donor cover the difference because they felt very compelled by, they couldn't reconcile their feelings about youth going home and not having food for the weekend. So that was really a neat thing. I see
Great.
Dan's hand.
Music to hopefully Carol's ears that the GCACH monies are catalytic in sponsoring other funding and other donations. So that's wonderful news. That's what we all like to hear. Any other quick questions about Southeast Washington for Jack or for Greer before we shove on?
Yeah, just a quick question, Jack. I saw that you mentioned or called out specifically the faith community as part of your partnership there. I'm very curious about their role in your partnership, as well as support from the faith community in addressing misinformation regarding the pandemic public health strategies. Anyways, that's a complicated question. I don't really expect an answer, but I think it's really admirable of your coalition to get them involved.
Well, and keep in mind, in these very small communities, most people at the table wear 3 or 4 hats, and including they work for the local hospital and they're very active in their local church. And so that's the way that we've been able to leverage those relationships. We haven't addressed COVID messaging that much. And so you're right, that they're a piece of that. And that is a much longer conversation, the difficulty in getting the vaccination rates up in these communities.
Thank you, Jack.
All right, let us move on to Walla Walla and Columbia counties. And Greer, are you going to start this, or is Amy going to start?
We're gonna let Amy start.
Oh, they just said, Diane said that you should start because of how they've sequenced it, and I am totally fine with that, Greer. Thank you.
Okay.
Yeah,
I'll go quickly.
Thank you.
So again, let me just flip my notes here. Oh, can we go back one? Sorry. Okay. So the Blue Mountain CHIP service area is Walla Walla and Columbia counties. We again served as the third-party administrator. We had access to $116,400.49 to grant out. We did award that money out to 12 organizations. We received 17 proposals. So that puts us very similar to the other service area at a 70% award rate. And the SDOH for this region is reducing barriers to housing, early learning and education, and reducing barriers to behavioral health care. And we actually saw requests and made awards that covered all three of those, and sometimes a couple of them together, I believe. Next slide. So again, you can see the awards that were made. The highlighted green ones are just the ones that I'm touching on in my presentation. Not an indication of preference or value, it's just the way it worked out. Next slide. So we'll start with Blue Mountain Health Cooperative, which is actually a really amazing new organization in town. So they opened on the same campus as the Providence Urgent Care facility, and they are a walk-in mental health clinic. So they are able to accept patients who would tend to go to urgent care when they're having a mental health crisis or a mental health issue, and they can now have a warm handoff from urgent care to Blue Mountain Health Cooperative, so that the mental health needs can actually be addressed in that moment, instead of these patients being sort of told to, well, call this number and make an appointment. They can actually get help right away. So the grant was awarded to them to open a second location, which they have done. And I don't have the address on here. I believe it's in Eastgate, Amy.
Yeah, I haven't seen the new one, but I know they are expanding. So sorry about that. We'll have to ask Elena.
I know. I'm pretty sure I have the address. I just seem to have overlooked that. But they're doing like the amount of cool things that this group is doing is remarkable. But so they've embedded behavioral health services at College Place Public High School. They have identified and supported training for one of their mental health providers to receive this autism spectrum disorder certification, which I believe is very much needed in our community. So, so we're very proud to support the work that they do. Next slide. Christian Aid, my goodness, Christian Aid Center. Emergency Shelter and Life Recovery Program. Again, another fabulous organization. You can see the stats here. They're serving 130 meals a day, which is huge. And since receiving the grant, they've provided meals to 33 men. No, excuse me, they've provided shelter for 33 men, 16 women, 13 children. Next slide. Hope Street is another newer organization that is working to provide services in a gap area in our community. So Hope Street provides sober living for women in recovery, or yes, women in recovery. So we're supporting them. Reducing barriers to housing is basically a general operating grant, but with the stable housing that these women are able to secure, they report that they're able to obtain employment, they're completing their high school, receiving their GEDs, or going back to school or continuing education with the community college. And so as the residents progress in their lives in that way, new women who are coming in are able to watch that progress and model after that and see what the possibilities are. Next slide. Sunbridge. This is a success story about the work and connection that their dental clinic has with their patients, where they were able to work with this patient, Bert, who sort of developed a severe anxiety and stopped coming to his dental appointments, and then eventually showed up again and was very much paralyzed by his anxiety, and how he was trying to cope with it was not working, and they were able to provide care and assistance and medical oversight to get him into resources and working with people who helped him manage his anxiety. And he's now working. He's in Texas with his family, and he feels very much like he has a second chance at life. So next slide. The health center. Miss Norma, I didn't see a response from you, but if you want to jump off mute, you are more than welcome. So Norma Hernandez is the executive director of the health center, and I had chatted with her to see if she wanted to speak to this during this slide. But they were given a $20,000 grant originally for something else, and we, because of COVID-related challenges to deploying those services, we had to revisit, and then we repurposed the grant to general operating, which is still supporting reducing barriers to behavioral health care, which is essentially what the health center does. So you can see through the resources with this grant, they've identified, hired, and then embedded a bilingual Spanish-speaking care provider at Pioneer Middle School. And it's a really, I like the way these numbers kind of flow into the outcome. So she's so far, since school has started this year, interacted with 7 students and 3 families. She's successfully coordinated 2 mental health appointments and then 3 medical appointments. And one of those medical appointments was actually a life-saving appointment where it was determined that this 13-year-old had a serious infection and needed immediate and emergency treatment. And that would not have happened without the care of this coordinator. Next slide. Unless Norma wants to talk. I'm not hearing her like jump up and down. Okay, Trilogy, we provided a grant to reducing behavioral health care. So I think we all know Trilogy has recently had a leadership change. And of course that always presents challenges to service delivery. But their new executive director, Dr. Gina Clark, has increased her staffing by 100%. And including hiring a peer recovery coaches who have actually spent time with 50 peers, and they're working to reinvigorate their programming, to offer Spanish language services. And she's really doing a great job getting out there in the community with the support of these partnerships. Next slide. This one was hard to summarize, but the YMCA is very actively trying to expand their oh my gosh, this is more than I've spoken in a long time publicly. Early childhood education through early learning and education. So these are all, I mean, these are not all, these are some of the really cool programs that they're doing. One of my favorites is this Let's Talk program, which is focused at middle schoolers to have a safe place and a casual place to talk about, oh, and look, I missed a word, bullying and racially motivated bullying is essentially what it is, and discrimination. But the Y is doing a lot of really neat youth-related activities. Next slide. And we were able to support playground redesign for the YWCA's Child Care Center. And they are similar to Pomeroy. They are in the throes of trying to schedule construction work with COVID pandemic supply chain challenges, but they have purchased their rolling stock, as you can see there, and it's going to be great when they get it done. Next slide. And the public library is back open, which is happy news for everybody in Walla Walla. And they've redesigned and refurbished their children's area. And this photo is not great, but the actual redesign is wonderful and much more conducive to kids learning and engaging with the library. Next slide. Oh, look, I'm done. And we're ending sort of where we started, which is a big thank you for the partnership that we're able to have with our GCACH, our LHINs, and everybody that we've gotten to meet in between with this process. It's been really fabulous. So thank you all. Amy.
Oh, thank you, Greer. Yes, thank you for your partnership. Thank you for managing all of those grants in the process. It's been super easy for us, which has allowed us to focus on other things. So Greer did all the exciting, fun, things that are happening in the community. And now I'm going to talk about the higher level stuff. So grab a coffee. So Blue Mountain Regional Health Partnership. So you'll notice that we serve both Walla Walla and Columbia, which is also in the Southeast Regional Service District. It's kind of interesting with Columbia County because they have a lot of services they get, with their partners to the east, but then they also seek most of their other services here in Walla Walla County. So that's why there's a little bit of overlap. So next slide, please. Okay, so this is the general overview of what the partnership did in 2021. So we met, we worked on Cope Calm Care, we worked on 211, Community Information Exchange, and our resources directory. We distributed PPE, and we're really working on our community health improvement plan and updating that. So I'll now go into each of these. So that's just the overview. Next slide. Okay, so good things about the pandemic. We all meet virtually now, just like this meeting. So attendance has been pretty good all year. We meet the second Tuesday of the month, except for we didn't meet in May and we didn't meet in July. We've been able to regularly feature Joyce Newsom from 211 and People for People, and that's really educated our network members who are key players in their organizations and in the community about 211. 211 had not been well utilized by Walla Walla County. We had used something called OWL, which was kind of like a virtual service directory, but it was static. It doesn't change. The city of Walla Walla had done it. It has an app that goes with it, but the information had become really outdated, and that became a real problem with the pandemic. We're a small enough community that we were kind of getting by with phone calls and, oh, the front desk will put you through to the new person. But once we got to the pandemic, it was sort of untenable. So we spent a lot of time educating the partners about that. And then we've also been featuring guest speakers about our focused social determinants of health. So for affordable housing and housing, we had Rachel Efbine, and then we also had Samantha Jackal, who is here at Walla Community Health. We had Nikki Sharp talk to us about behavioral health, and Nikki now works here at Community Health, but she worked for years and years at Comprehensive Health. So we got a good overview of what's going on with behavioral health. And then Isladon McClellan from the Walla Early Learning Coalition shared the preliminary results of a needs assessment that they did. And just to share with the group, that was a really hard presentation. There was a little bit low attendance because it was in July and most people were on vacation. But Islandon shared that I think Columbia County currently has no licensed childcare. That was, I learned that. I was like, what? Or maybe it was August when she presented, whatever month she presented. Yeah, it was the beginning of August. That was a real shock to me. So that's definitely going to be a focus going forward. Then I put down there, our focus project is focusing on our community resources directories. So next slide. Okay, so we've also worked on the Practice the Pause, Cope Calm Care. We shared all the online materials with our network and really made sure that they were aware of them, again, because of it being the pandemic and they being key players. We really tried to push out to the community those materials. We did outreach as well to our local schools. We here at Community Health meet with them weekly, sometimes twice a week to discuss the COVID situation. So we also directed them to those resources because as children headed back to school, there were a lot of issues. And we wanted to make sure they were aware of that. We directed people to get trainings through Serenity Point as a training provider. Nicole Husted there was offering training. So we made sure people had Nicole's information. Oh, good, thank you. And also, hold on, I've got a chat coming up, but I can't read my next bullet. Oh, now I've got to get out of there. Okay. And then, oh yeah, access online materials. So we also use the online training and made sure that all community health staff here, and then we also sent it out to the rest of the county, knew about all of the Practice the Pause materials so that we could push it out because there is quite a mental health burden with the pandemic and we often are on the front lines. Next slide. Okay, so as I mentioned before, so our huge focus for the Community Health Partnership has been this local resource directory. So the aim is to build support for a central resource directory, and our ultimate goal would be a community information exchange and to collect input from all community sectors to ensure that the community information exchange is utilized and successful. We worked for the first part of this year, probably the first whole half of this year, to try to see if we could resurrect the old OWL app. There were a lot of community members that felt really strongly about this app, and for its time, it was fantastic. That time was more than 5 years ago. So we just kind of had to work through that process. And so we had folks, look into it. We had folks try to use it. We had folks give reports about it. And David Lopez for this Walla Walla University Center for Humanitarian Engagement was wonderful with that. And then Joyce from 211 was wonderful in exploring what is available through 211, making it easy for people to update their directories, sharing information about data that would be available about our community with the partnership, and then just what the possibilities were. We just had to work through that whole process. So we are getting there. People are really starting to voice what they think a local resource directory would look like and start to ask sort of the next questions. Next slide. Okay, and then we still have PPE from, I think Brisa gave it to me last year, and we are just sending it out there. So the pandemic has been huge in Walla Walla. Anyone who's contacted us who needs cloth masks and the small number of children's masks that we've had, Jody Ferguson, our emergency management director here at the county, she keeps track of that. And we have about 6,000 adult masks remaining. And there's the list down there of who we distributed them to. all the children's masks have been used through Children's Home Society. They have the local Early Learning Center for Early Head Start. And so we've made good use of that. And we've had a lot of community requests for masks. As the pandemic has worn on, the expense of continually providing masks to make sure that people are masked in facilities and aren't excluded from especially community events, vaccination clinics, et cetera. It gets to be important. Any one mask is not that expensive, but over time, these organizations can't bear that cost. Next slide. Okay, so now we're focusing on our community health improvement plan and looking to update our social determinants of health. There are 4 members of the partnership who are going to meet. We've actually scheduled our first official meeting in early December now. We had some scheduling issues. And we are going to look at all the different community health assessments that have been done and update the CHIP. So Providence is working on the community health needs assessment for St. Mary's. So we will use that information. Walla County is doing the behavioral health needs assessment currently. There was just a listening session last night. We have the recently completed early learning assessment. And then there's quite a bit that's been going on with the Anchor initiative and the housing initiative. So we're going to take a look at all those assessments, see what is available, and really rework our CHIP. I was very interested today to hear about some of the work around food security and wondering, if that may be a new area in our county. So we're definitely revisiting that. And I think next slide might be it. Okay, so I am to the end. Does anybody have any questions?
And we've got 3 or 4 minutes, so fire away, everybody.
And ask questions for Greer about all those great programs.
This is Joyce with 211. I just wanted to say thank you to Amy for the shout out. I am definitely here to help all the different LHINs get acquainted with the work that we do with the 211 system, getting your communities connected to their resources. As Amy mentioned, COVID has presented its own unique challenges in making sure those resources are monitored, kept up to date, and the most accurate information given out to the communities. And we have dedicated staff to do that. So we are doing that legwork for you. So please utilize us if you wish. Thank you.
Thank you, Joyce. Any further comments or questions of Amy Greer?
I have a comment. Oh, Carol, go ahead.
Thank you, Greer. By the way, I love your first name because that was my maiden name anyway. So just a shout out to the work that's being done on the CIE with Walla Walla. As you guys know, that this is going to be a huge focus for Greater Columbia ACH next year, kind of during the bridge year. Still trying to figure out how that's going to roll out, but we're really grateful for Joyce and her support of getting out to all the LHINs and asking them to update that information on that resource directory, because you have to have a source of truth. You have to have good data before you can really develop those referral networks. So thank you so much for your work on that. And there will be, hopefully some more support next year for that work.
Well, thank you, Carol. Yeah, we're very excited about that work.
All right, more questions of the Walla Walla Columbia County experience over the last year. Maybe Greer, you're off the hook. Maybe Amy, you're also off the hook. I don't see too many hands raised.
So Patrick, I just have to say this. Also a shout out to Southeast Washington. Let's see, what's it called? I keep forgetting their name.
CWAP, Carol. It's
CWAP. I remember when we first met with this group and they were really focused on the youth. And I'm so happy to see how they have aligned all of their grant programs around the youth bullying, youth drinking, youth substance use, youth housing, overweight youth. So having that focus, that targeted focus is really what Collective Impact is all about. And I just wanted to congratulate them on that focus. Thank you.
Well, and Carol, thank you. I just want to also comment. I said earlier about the importance of small grants, but small grants are also most useful when, as you say, you're working on collective impact. So lots of different organizations doing lots of different things, but focused on some common problems. So I think we're starting to see signs of how well that's working in the communities.
Thank you, Jack. All right, we will end our tour through Greater Columbia's geographical footprint in Whitman County. I think we're going to start with Elizabeth. Is that correct, or is Becky from the foundation going to start this presentation?
This is Becky. I think I started, right, Elizabeth?
Yeah, your slides were first when we sent them. Yep, there you go.
All right, so Elizabeth and I are with the Whitman County Health Network. I also serve as the TPA for the Pullman Regional Hospital Foundation. So we're a little bit different in that our foundation primarily serves Pullman Regional Hospital, but we serve as the fiscal agent for our LHIN, the Whitman County Health Network. So a little different than some of the other TPAs that are granting organizations. That's not our primary function. So next slide. So with our initial funding, we had partnered with WSU Extension to implement the Strengthening Families 10 to 14 program within Whitman County. And we had a great start, and we were providing trainings. We had hired a coordinator, and we're just getting up and going, and then the pandemic hit. And so we had to take some time, kind of put it on pause. And then earlier this year, in the kind of over the winter and into the spring of this year, we were able to pivot and come up with a new model and work with Extension to get the information out to families through a home kit model. So we ended up providing 300 backpacks of Strengthening Family Program lessons into homes all throughout Whitman County. So that went to all the smaller areas of Whitman County, plus some in, the bigger areas, Pullman and Colfax. And so overall, I think that was very successful. We were able to probably get the information out to more families than we would have if we would have met in person. And, so we continue to promote that program within our county and check up on those homes that got the information. But that overall was a success despite the challenges we faced with COVID hitting our area. So next slide. And then with our current funding, we were able to provide support to Coast Transportation. Coast provides on-demand public transportation for any person in Whitman County to get to health and social service appointments. So the funding that the TPA has provided will help fund their current programs and actually expand those programs to provide more services within Whitman County. In our needs assessments in both 2015 and 2018 that we conducted, transportation needs was a major challenge within our county. And so the Whitman County Health Network has been working to come up with programs that would address that. And so this is one of them. So we're excited to partner with Coast. They are out of the aging, oh my gosh.
Aging and long-term care.
Thank you. Aging and long-term care office out of Colfax. And so they really do serve the entire county and also provide transportation for people in Whitman County to other counties. So if people have appointments in Spokane or down in the LC Valley or in Moscow, they'll also provide transportation to those appointments as well. So excited to kind of get that partnership up and going and see what kind of expansion and services they can offer for our community. Next slide. Recently, we received a grant from the Department of Health, and also I think this was in partnership with the CDC. This is the Population Health Community Outreach Funding. Whitman Hospital is going to serve as the lead partner, and we're working on a plan to develop COVID-19 testing in Northern Whitman County. So Northern Whitman County is quite a ways away from kind of the hub of Pullman. It's kind of equal distance between Pullman and Spokane. So it's a really hard area to serve just because it is so kind of far away. We have such a vast county. And so Whitman Hospital is working to develop a program so that the outlying areas of Whitman County will have access to COVID-19 testing. That grant was in the amount of $377,000. We're just now working through kind of the contract and what that will look like as far as the scope of work and getting that up and going. It's kind of been delayed just because our hospitals are very busy at the moment, and full. So we're working to get that scope of work completed and that contract completed so we can get that up and running. The next slide. And then also the Whitman County Health Network hosts and manages the Palouse Resource Guide. So the Palouse Resource Guide has been around for many, many years. It started as a print version of a resource guide and then transitioned to an online resource guide. So it's kind of like 2-1-1, but just for Whitman County. And I guess the surrounding counties, there's also resources that our community members in Whitman County can access in the surrounding counties. But we continue, excuse me, we continue to manage that and update it on an ongoing basis through the Whitman County Health Network funds. Next slide. Oh, and this is Elizabeth.
Okay. We did not have much of a segue there, did we, Becky?
No, we did not. Sorry.
So in Whitman County, as in all large rural counties, food access and transportation go together, don't they? Because it's hard to get to good food if you have limited transportation. And so these are two of our major social determinants of health in Whitman County: is access to good food, fresh food, and transportation around the county, not just to medical appointments, but for social service needs. And so Community Action, which serves the entire county, has been working for a couple of years on this idea of a mobile farm stand with the support of the Whitman County Health Network. And this year it came to fruition. They have a mobile van. They have several community partners, including organic farmers, the WSU Organic Farm, and then some local private farmers and Backyard Harvest who donate fresh produce to this mobile van, and they can travel the county and provide fresh food to people who might not otherwise be able to drive into Pullman or Moscow to the farmers markets. They were able to do this pay what you can afford model, which means that they invite everybody to go, of course. So if I were to go, I can pay whatever I think I can afford for a head of kale, and that might allow somebody else to pay less. So because they have developed such great partnerships, it's sustainable and affordable for large groups of people. And they have done great outreach to the communities to allow them to request times to come so they can work with their community partners about when would be most beneficial for them to be in their areas, and then let their community members know. So really excited to see how that plays out over the next year or so, but we're happy that they were able to complete that project. Next slide. Thank you. So everything revolves around COVID, right? So in actually going back a couple months, last winter, 2 other health network partners, Pullman Regional Hospital and Palusa Medical, joined together to open a respiratory care center so that people who were actively sick were not coming to the hospital or into medical clinics and potentially infecting others. So that's what we did last winter. In the spring, when early summer, I don't remember the dates, I'm sorry, when things appeared to be getting better, that was closed. But then, recently with the Delta variant, March 2021, thank you, TJ, we realized the need for testing was again ramping up exponentially. Our clinics were overrun, our emergency department was overrun. We just could not test people in a timely manner. So Pullman Regional Hospital and Insight Laboratories joined forces and were able to open a testing center in Pullman. So anybody can go. You do need a doctor's order. They've got a 24-hour turnaround for results. So that has relieved the burden on our healthcare providers and our emergency department to get people the testing they need, which is so vital to stop the spread. And so far it's been very successful. So it was great to partner with a new partner too. They are not, Insight Lab is not part of our health network, but they were super willing to step in and help the community. And, that's the benefit of these larger groups, is that we can all work together and it benefits the whole community. So next slide, please. Practice the pause. We were so grateful for this resource. So thank you for everybody who worked so hard to put that together. And the Whitman County Health Network took the lead on getting, being the hub to receive the pamphlets here and then disperse them out to medical offices, to private organizations that wanted to help distribute them. And Palouse River Counseling helped to lead that, which is also part of the health network, gathering and dispersing them to schools throughout the county. So we thought it was a great resource. People were really excited to have that. That was so simple and easy to access. So, but it was a lot of boxes and a lot of material. So it was good that we had a place to store them and then people could come and pick them up. And so it was, again, helpful to be able to work together, especially in a county where, it's just hard to get them out. So when we could identify people who could get them out to a rural school, a rural medical clinic, it just helped us ensure that we got it to a broad audience as possible. Next slide, please. Okay, I don't know that we need to talk about this again because you pretty much covered this, Becky, don't you think?
Well, this is kind of the other piece to
Oh, I didn't read the whole, sorry. The gas cards, right. So we use LHIN funding to buy gas cards because, again, transportation is so challenging. And even when people do have cars, the price of gas can be an inhibiting factor in whether you choose to go to an appointment or not. So the gas cards, Becky actually took responsibility for purchasing and dispensing those to medical clinics throughout the county. And what we have found is that the farther out the clinic, the more useful that they have found those cards. Wouldn't you say, Becky? The TICO clinic, the St. John clinic have really.
Yeah, absolutely. They've definitely used all of the cards and requested more that we have been able to provide. So yeah.
It's been nice to have the funding to be able to be creative in how we are helping people manage their transportation needs. So, okay, next slide, please. So the things that we're trying to continue on, the big program that obviously we're funding and helping support is the Coast Transportation Program. But the smaller programs that we continue to work on are the Practice Transformation, which is primarily the hospital and Pullman Family Medicine in the clinic network. So just all the good work being done out of that, patient-centered home, integrated behavioral health. As a piece of that, we were able to embed a social worker for the first time in the pediatric practice, and that has been really helpful to have on-site social worker there to provide resource and referral and limited therapeutic intervention to families and children in need. The Opioid Resource Network, you know, so many of these things were, the work was inhibited when face-to-face stopped. I mean, a lot of us do enjoy Zoom because you can do it from anywhere, you get more active participation from professionals but when it's people who have limited access to internet, who may not have a laptop or a home computer, it was not helpful. It has not been helpful. And I think the Opioid Resource Network has been one of those things that got interfered with a little bit. But they continue on and we continue to support them. And the Whitman County Suicide Prevention and Resiliency Task Force continues to do amazing work in Whitman County. They helped with Practice the Pause. They really loved that resource, and the role that they played there was working with the county libraries and senior centers throughout Whitman County to make sure that they also got it. And they developed they do what I call the long training, mental health first aid, but that can take a whole day to attend, right? So they developed a new program, 2 to 3 hours, and made that available to anybody, any organization that wants to host them. They will come to your community, they will come to your organization, and it's much more accessible. It, of course, can be offered via Zoom, but something that you can do in 2.5, 3 hours, and you can get some just very baseline skills about how to identify somebody who's suicidal, where to direct them. That's been really important in our county. So we're excited about their continuing work, and the Greater Columbia has so willingly providing funding to them to continue developing trainings and offering trainings has been huge. So we do thank you for that. And I think that might be it. Oh, the other thing that's coming up this year, we're preparing for the countywide needs assessment that happens every 3 years, and the LHIN actively supports getting that done so we can identify, again, what are the upcoming needs in our county, what are things that weren't impacting people 3 years ago and are impacting them now. So it, you know, it's obviously will be pre and post COVID outbreak. So it'll be really interesting to see what changes in our county over the last 3 years. So, and that should be done this year, I believe. And I think that's it.
Okay. Thank you, Elizabeth. Thank you, Becky. I just want to, before we sort of close this chapter on Whitman County, to see if there's some comments or questions. For those of you following the activity in the chat box, there have been some comments from Terry Lane, from Lindsay, and Samantha about some of the activities in Whitman County. Any one of the three of you would like to comment on that further? Like to elaborate those? Any one of those comments?
Well, I'd just say that the gas cards are a really important way to support people and families. And one way that our community mental health center is using them is not just around appointments, but about supporting positive family interactions, right? So you would like to go do something fun with your kids, but how do you afford to do that? Well, if you can have gas, to drive them into Pullman to go to the movie if you live out in the county, then that helps provide a really positive interaction and relieve some of the burdens. So we do view it as not just about making medical appointments, but about impacting lives in a positive way. So, and I too love the social worker. I am an LICSW, and I love working with children and families directly. So it had been a passion for years for me to get somebody into the pediatric practice, because the warm handoff is so much more impactful than receiving a phone call from a social worker after the fact. The term social worker comes with loaded meaning for a lot of people, a lot of families. And so when you can sit down face to face and you can develop some rapport, you can do a lot more work with people. So I just believe in integrated behavioral health, though. The entire Whitman County Health Network does, and I'm sure most of you agree that it is just such a great way to provide service. So we're excited about having her there.
Great, thank you, Elizabeth. Any more comments about the Whitman County experience?
I would just like to chime in briefly at how effective the Whitman County group is. At one meeting, they were talking about how to deal with transportation issues. And I mentioned that the Southeast Washington group had started using gas cards. And over the period of, I think it was probably less than 15 minutes, the Whitman County group had said, yes, this is a great idea, let's pilot it. They had figured out how to do it. They had figured out who was going to run it. They had completely organized it. And that's because they work so well together. So I just want to really commend the things that they do.
Thank you, Jack. Greer, do you have a comment?
I was just going to kind of comment on the comment that was in the chat there about purchasing the gas cards from a local business. That's actually what we've done. We have partnered with a local, it's Bush Distributing, but it's a locally owned branch of that. And they've actually provided us with a discount on the gas cards that we purchase. And so that's been a really good partnership as well. So I can just reach out to Eric when we need more gas cards, and he sets it up at one of their stations and I can go pick them up, and he provides a 20% discount. So it's pretty substantial. And it's been great to work with him.
Very good. All right. Anybody else? Lindsay, you've been pretty prolific in your contributions to the chat box. Do you want to just elaborate on that anymore, or are you good? Okay. All right. Well, I think we're at the end of our session. We don't have to necessarily go to noon just because it said 12 o'clock stop. I don't know about you, but this has been almost a dizzying presentation of how many different ways we can affect health through social economic determinants. And I don't know if I want to put any of the GCACH staff on the spot to say that we will list all these on the website, but I think is that not true, Stacy? We will have this file of all these different PowerPoints up there relatively soon, so that if you do want to follow up with somebody, you can do that. And I'm sure if you need an email or some contact information, Stacy or other members of staff would be happy to provide that, correct?
That is all correct.
Okay. Well, Diane, are you still on the line?
Yes, so I just wanted to say thank you to all of the LHIN leaders and the LHINs that are the partners that work with the LHINs, and also the TPAs. We really appreciate all your hard work. It's a hard work that you guys are doing, but you guys are doing a great job. And we really appreciate all of your hard work. Theresa, did you want to say anything?
Sorry, I forgot to introduce at the beginning of the meeting. So I'm the Community and Tribal Engagement Specialist, and I've been working directly with all LHINs and TPAs coordinating quarterly meetings, getting their reports, putting together all their slides. So I'm just very thankful to have had the opportunity to work with you all. I'm excited to see what new accomplishments we'll get in the next year. And thank you all for such great work that you're doing in your communities.
Right. Little by little, I think we can say we're moving the needle. It's kind of hard to measure sometimes, but I think we can get a sense of some pretty positive changes here. Diane, do you want to say anything about our November meeting? We will have a leadership council in November,
So,
none in December. So this is the second to the last meeting of the year, but there will be.
Next month, we're going to have Dr. Kira Maseth. She's going to be coming and giving us an update on the behavioral health in the state of Washington. And then we will hear more about the patient activation measure that the Yakima LHIN has been doing for this last 2 years. And so we'll get a presentation about what it is and how it's been successful in their organizations that have been working with. We'll hear from Yakima Neighborhood Health and Catholic Charities and Triumph. So it'll be a good meeting to learn about the patient activation measure.
Another not missed leadership council meeting. So I hope you can all join us. And it will be the Thursday before Thanksgiving. So just mark your calendars. And please, if you wouldn't mind taking a minute to fill out the SurveyMonkey form here. I think there's just 3 or 4 questions that will help the staff as we plan future meetings like this. Hope you get a chance to get some sunshine before those gray clouds roll in. I know that we're expecting a bit of rain over here. So I'm going to be on my bike this afternoon and trying to catch up with Carol Moser's mileage for the year. Hope you can get some exercise as well. And unless there's no other comments, I think we are adjourned. So take care, everyone. See you in November.
Thanks, Patrick. Thanks, everybody.